Hello, friends. Thanks for joining us today on the School Transportation Nation podcast. This episode is brought to you by TransFinder, the leader in school bus routing software, and our tech tip is brought to you by Zonar. I'm Tony Corcoran, the publisher of School Transportation News.
And once again, I'm Ryan Gray, editor-in-chief. A little bit later, we're going to be joined by Tim Ammon. He's co-owner of the Decision Support Group and was co-manager of the Student Transportation Aligned for Return to Schools or STARTS task force. He's going to come on and let us take a peek under the hood on that whole process. And then we'll be joined by Dr. Lori Desautels of Butler University. She's going to be talking about adverse childhood experiences and students with special needs on school buses.
That's awesome, Ryan. Really looking forward to hearing them. Also want to give a shout out to some of our listeners today. We have Bill Harvey, Director of Transportation and Security, Lima CSD at Honoway Falls, New York. That's a tough one, but I want to let everybody know that you can subscribe to the podcast, Apple Podcasts, Google Podcasts, Spotify, wherever you listen to podcasts. Great way to access each episode and check it out. All right, Ryan, time to jump into the news and information. I hear LA Unified, the second largest school district in the U.S., has made some decisions.
Yes, definitely. A lot of attention on this one. So again, like you said, it's the second largest school district in the nation, right behind New York City. And LA Unified is opening up their school year going to a full remote learning model. So no in-class, no school buses running across the city. A lot of eyes on this again, and a lot of other districts in California are following suit. San Diego Unified to the south, San Bernardino Unified just to the east, San Francisco Unified. And this is not just a decision that is limited to urban areas, seeing this in rural areas of California as well. For example, Stockton, California, Lodi, California up north. So it's really interesting where all these school districts are falling on the spectrum, especially when you consider just to the south of LA, we have Orange County. The Orange County Board of Education, on almost the same day, they voted 4-1 to send kids back to in-person classes. So there's a dichotomy going on right here. But what they do suggest is that school districts continue with regular temperature checks and, of course, encourage social distancing, but it's not vital. And they even advised, which this is very curious, they advise against the use of masks, citing the difficulty of ensuring that students wear them correctly and that they actually might be harmful to some children's learning and mental health. So, as we've cited previously, a lot of the Orange County guidance centered on guidance from the American Academy of Pediatrics, as well as American Medical Association. They indicate that K through 12 students are at the least risk of contracting COVID-19, also have a quote-unquote minor role that they play, children that is, in transmitting the SARS-CoV-2 virus to adults. It also cites the opinions of, and actually the empirical evidence of many nonprofit and for-profit childcare centers. For example, my daughter's preschool has remained open throughout this pandemic. There hasn't been one case that we're aware of. NPR spoke to many of these agencies, including the YMCA and the New York City Department of Education, and learned too there have been no reported cases yet anyway. Then again, the guidance in Orange County, as well as a lot of school districts that are choosing to go back, and Florida is pushing their districts to all do this, is that rates of child abuse have increased amid stay-at-home orders. Teachers and school bus drivers and other mandatory reporters are not able to gauge the welfare of their students. Now, it's important to note that this Orange County vote is a recommendation. But according to a CNN report, half of the county school districts said they won't comply. They're already leaning that way. And the others are looking at some kind of remote education or hybrid models, basically giving parents the choice.
Yeah, that's troubling, Ryan. I mean, we're definitely seeing dissension among the ranks. Everybody's kind of feeling a little different. It's yes, we're going back. No, we're not. Maybe, I don't know. It's totally the gambit that we're seeing out there. What are some of the other districts that you're talking to? What else are we seeing?
Well, Atlanta Public Schools, they announced that they're also going back to distance learning, at least for the first 9 weeks. Houston ISD, Harris County, one of the largest counties in the U.S., they have been hit really hard by this surge, if you want to call it that, with all these new cases. They're going to online classes to start school before ostensibly returning to in-person instruction some weeks later. Nashville, Tennessee, they are going to return to in-person classes, but now they're remaining online through Labor Day. Meanwhile, Miami-Dade County Public Schools, they've set up an 8-point criteria that they must meet to reopen school in person by August 24th. These include diminishing COVID-19 cases under 10% locally for a stretch of 14 consecutive days, an improved quantity and quality of contact tracing, and vaccinations of all school children.
Yeah, Ryan, that's really interesting stuff. I know there's a lot of medical and science-based opinions out there too. You want to share a little bit about that?
Yeah, so I mentioned earlier, Orange County Board of Education was drawing upon a couple of those. Again, the American Academy of Pediatrics recommended last month that the best place for students, especially looking at elementary school, right, where you have younger kids that aren't able to social distance, or at least as well, or they have problems wearing their mask. And frankly, where a lot of the online remote learning really has not worked as well as, say, kids in middle school or high school. That's what the Trump administration has really relied upon heavily as evidence why kids need to go back to school. Now add the national academies, which is the nation's collective of preeminent engineering, medical, and science experts. They issued a report last week that also advises for students K through 5 to return to class full time. They basically say, like I said, distance learning is not appropriate for them. The benefits of in-person instruction are even greater for students in 3rd grade and below, as these children have developing skills and really have the issues with regulating their own behavior and emotions and attention abilities. And the same goes for students of all ages with disabilities. Then days later, the Centers for Disease Control and Prevention released some alternative information, if you want to call it that, from state tests that show that children make up nearly 6.5% of reported cases now of COVID-19, with hotbeds in areas like the aforementioned California and Houston area. There's a COV Kids project, COV Kids project, that's cited in a recent article by Bloomberg that has been tracking these trends. And through the report last week, they found 769 pediatric intensive care admissions and 66 deaths in people under 20. And they're saying this is a rise during the recent surge, which is also being attributed to folks in their 20s, 30s, 40s, and 50s. So we're still hearing a lot of back and forth on this. The National Institutes of Health began a study in May looking at 6,000 children to try to determine the rate of coronavirus infection in children. That study is still ongoing. It's slated to last another 6 months, meaning we probably won't have results till November. But certainly, we're hoping that a lot of schools are back by then. Maybe not, though. Still, things are all over the board. So it's really interesting to see how this is all going to play out. Still, when I was looking at this Bloomberg report, 66 deaths compared to some 138,000 nationwide, with about 8 and 10 of those occurring to people over 60 or with underlying medical conditions. You have to wonder, how is this all going to shape out?
Ryan, that's really interesting data you provided. As school districts come together and decide what are those next steps, finding a partner and a technology that marry up is so important. Our friends at Zonar, a leader in smart fleet management, are providing our tech tip this week. New school year, new rules to protect everyone on the bus. As you plan ahead, make sure your fleet management tech supports health and safety efforts and the CDC guidelines. Turn to our dedicated team of safety and compliance experts. They understand your challenges and can help make sure your fleet is ready to navigate the year ahead safely. Learn more at zonarsystems.com/protect. That's zonarsystems.com/protect. We've got 2 great guests coming up. Stay tuned.
So what's been on the forefront of most people's minds in the industry has been these recommendations, this toolkit from the STARTS task force. It came out last week, and we are pleased to have Tim Ammon on with us now. Tim is the co-owner of Decision Support Group, and he was one of the co-managers for this extensive, exhaustive process. Tim, how are you doing today?
Very good, Ryan. Thanks very much for having me.
Hopefully you've been getting your sleep, because I know over the past 6 weeks or so, you're going hot and heavy on this, burning the midnight oil. This came out last week. Again, a lot of people were really highly anticipating it. Can you take us through what the mission of this STARTS task force was to do?
Sure. And I think it's important to recognize at the beginning of this that the task force itself was very aware of the fact that it had no specific authority to tell people what to do. And so as a result, what we needed to do is create an environment and create a set of tools that were going to allow transportation professionals to build their reopening plans for the start of school. And our specific focus was on having a resource for transportation professionals built by transportation professionals that would allow them to look at the various expectations of state reopening plans and Department of Education reopening plans and determine what the best course of action for them in their individual conditions would be to be able to successfully, to the greatest extent possible, reopen schools.
Okay. And as I mentioned, it was an exhaustive effort, 70 pages report, has these spreadsheets and these toolkits for school districts and contractors to use. So that aside, just the work that went into it, can you tell our audience what some of the most surprising results that came out for you and the task force when you were working on this?
Sure. One of the biggest surprises was actually how consistent the macro level expectations, how consistent the guidelines were from state to state. So as is identified in the report, we looked at 50 reopening plans from both states and other industries that are related, from transportation and from Department of Education plans that came out. And what we were able to do is to boil all of those reports down into 27 macro level guidelines, expectations that we thought were going to be applicable to transportation departments. So I think that consistency of the expectations was surprising, because what we know is the actual implementations that are going to occur at the local district level are going to be very different, and maybe very different neighbor to neighbor, depending on how individual school boards and individual school leadership decides to interpret some of the guidelines that were provided. I mean, the most obvious one, and the one that a lot of people have spoken about, is this issue of physical distancing on the bus, or the wearing of masks is another one, right? The interpretation of those expectations is really what will create the divergence between the plans, even though there is some discussion in all of them about an allowance for wearing masks. So I think, as we have talked about several times, what was so interesting about the process itself was to realize, how national the problem is, but how local the answer and the solution will be.
Gotcha. And then to that point about social distancing and masks, there's been a lot in the news for the past couple weeks now, several weeks, months, really, talking about the difference between what some science is telling us and what some people's just fears are. And I know that this is supposed to be a toolkit, right? But you guys do have some opinions on some of these things, right?
We had what we would describe really as guidance. What we don't do is to say whether your physical distance, social distance needs to be 6 foot or 3 foot or 0 feet. There's no task force recommendation on that. What there is, though, is a discussion about, if your district chooses to set a requirement for physical distance, here's how you can go about implementing that. Here's how you can go about looking at the specific tasks that are necessary to accommodate something like physical distancing. Alternatively, if the district says all students will wear masks, what the guidelines and the tasks underneath them are designed to do is to say, if that's a choice, there are a bunch of different considerations that have to occur relative to that, including who's going to provide the mask, what's going to happen if a student doesn't have one, how are we going to track those things, who's going to pay for it, all of those considerations that go into that initial choice of the guideline around mask wearing or not.
Gotcha. Okay. And then I know that this is a living document, so it sounds like there could be updates to it. Mm-hmm. Is that correct?
That's correct. Yeah. We have explicitly tried to put this in a context and tried to make it available to people in such a way. And what I mean by available is usable in their actual planning for reopening. And so as we start to get feedback on what people are doing or how guidelines are changing, there is an intention to be able to update and revise and re-release information and resources as conditions change.
Okay. So those 27 guidelines, I think that's what the final report spit out. And then I think there's like 225 different tasks.
Correct.
Those could actually increase.
It could, if what happens is, so if we just take the case of what happens if we have a reclosing after there's been a reopening, it's likely that there will be some transitional issues that will be associated with guidelines and tasks that'll have to get considered. And to the degree that we can incorporate that into the resources, whether it's the spreadsheets themselves or to a set of frequently asked questions, it's the intention of the task force to be able to do that.
Okay. And one of the other challenges that I gleaned from the webinar on Friday was the special needs and students with disabilities aspect of this. It has its own set of guidelines almost. That really adds complexity to the whole issue. It
does. As with most things, there are going to need to be specific considerations given to students who have special needs. And we would talk about it in terms of specialized populations as well, because I think the challenge associated with homeless students and students in foster care, while different than those associated with students who have IEPs or are otherwise identified, those challenges are going to be really difficult for some districts to accommodate when and if there are restrictions on capacity or they're making policy choices about restrictions on ride times or whatever it might be. So it is clearly going to be one of the more difficult aspects of any of this integration that will occur from a planning standpoint of here's how we're going to do routing as it relates to physical distancing, and then the implications of that on specialized populations, and then how that may in turn change the way that routing has to be done because of just the resource constraints.
Mm-hmm. And then I know that really this report, it was prefaced by stating that to utilize this toolkit, districts really need to know which direction their school district is going in terms of the educational model, right? What if there's some districts out there that are still trying to figure that out?
It is a real challenge, and we see a lot of that still, that districts have not decided, and particularly given the resurgence of the virus or even the surgence of the virus in certain locations, there remains a lot of uncertainty around the models. But what we had tried to do in the way that the resources are designed is to give transportation professionals the opportunity to model different scenarios and to use the sheets to say, well, what if we're under a hybrid scenario where it's K-5 going in and it's 6 to 12 staying out? We can look at the guidelines and the tasks and model that out and say, here's what we think the system will look like. Alternatively, if it's a full-on back to school, but with very strict social distancing, here's what the scenario may look like. So it's our hope, and it was the intent of the design, to allow transportation folks to be active participants in informing that choice of model by having a feeling for what the consequences of particular choices were going to be from a transportation perspective, and then how that rolls out into just a general access to education question. What's interesting about the process, I believe, is that the whole model was built on collaboration. The collaboration of the three associations to start with, and then the presidents of the three associations, and then collaboration amongst each of the individual committees that had their specialties, whether it was the health and safety or public relations and advocacy or routing and scheduling. So I think the entire model is going to be built on this. And what we know is that the best way for transportation to continue to be an active and effective participant in access to school is to partner with all of the organizations that are going to be looking at some sort of input into the process, whether it's public health officials, whether it's policy officials, senior administrators. Transportation being a partner in that is going to be a critical element in success in the fall.
Hey, thanks, Tim, for sharing your thoughts. Shameless plug for Decision Support Group. Definitely, if you guys are sorting through that 70-page document, Tim and his team are available for hire to help you walk through the process. So make sure, give him a call, reach out. Partners are so important right now. And speaking of trusty partners, I want to share a little bit from our partner, TransFinder. Their new web-based routing solution, Route Finder Plus, is making the magic happen for their clients. Plus is critical for today's COVID-19 climate because it allows routers to work remotely at lightning speed. It allows districts to create as many what-if scenarios as they want. For example, districts deal with how many students they can have on the bus to meet government guidelines. Then they can flip the switch and activate any of the scenarios they've already created. With the report writer, you can run cost analysis as well. Because it's web-based, you could do all of this from your home or office, basically any place you have an internet connection. It's no optical illusion. Contact TransFinder now to see how they can help you reopen school. Email getplus@transfinder.com and put STN podcast in the subject line and be the first from your state. TransFinder is going to set you up with an Amazon gift card. Coming up next, Ryan Gray and Dr. Lori Desautels from Butler University are going to talk about transporting students with special needs.
Pleased now to be joined by Dr. Lori Desautels. A lot of our listeners will remember her from our 2018 TSD conference in Frisco, Texas. She's agreed to come back on and join us today. Dr. Lori, how are you doing today?
I'm really well, Ryan. How are you?
Very good, thank you. I know you've been very busy. We were talking a little bit earlier about all the virtual presentations and talks that you've been having. Certainly, a lot of what our audience has been looking at in terms of getting back to school is still balancing the whole get back on the bus for kids that can go back to class or the remote learning. We know that so much that we've read and seen in the nation's news is that online learning just really isn't conducive for a lot of children, and especially those with special needs. Can you talk a little bit about your perspective on all of that and some of the challenges?
Absolutely. And first of all, we were all thrown into virtual learning. This was not planned. It was not discussed. And literally, our children were in school one day across this nation, and then they were home. And so everybody was scrambling. So it's been a really difficult time with that aspect. And we know that many of our students, and as you mentioned, many of our children and adolescents that have emotional and physical and very challenging needs, this has been a real shift for them. And we also know that many of our students did not have technology when this first happened. I know in the state of Indiana, 1.1 million students when this began in March did not have access to technology. So this time has been just a huge challenge for educators, for students, for parents. We were all thrown into different roles. Parents were teaching, teachers were parenting, administrators were parenting and teaching. We saw a job loss during this time. There were many, many children leaving school, which was their safe and connected place. And they were thrown, into some chaos and not knowing what the expectations were as far as how do I access technology? How do I learn? So many questions on top of this pandemic.
So you talk about that chaos, right? You do a lot of brain research on adverse childhood experiences, and some of our listeners will know what that means. But can you tell us what that means, just for the sake of explaining that, and why it's so important that school bus transportation people understand how those can manifest in children with special needs?
So I think most people have heard of the Adverse Childhood Experience Study, which was originally conducted in the 1990s. And this was the largest public health study of its kind when it was published by Vince Felitti and Robert Onda. And I actually talked about it when I was in Frisco in 2018. But since that time, many studies have burgeoned. And now we're looking at different ACEs. In the mid 90s, they listed 10 adverse childhood experiences. But we know today that, for example, our special education students, our Black and Brown students are disproportionately punished and over-identified in our schools today. And so there are many ACEs that in 2020, this pandemic has given an ACE to everybody. We call this adult adverse experiences, adverse childhood experiences. And so when we think about the implications for transportation, our transportation personnel are oftentimes our first responders to kids. They have the connections to build these, which we call touch points. And adversities affect the developing brain and nervous system in the body. And so when I was in Frisco, I loved sharing this with bus drivers because bus drivers have this incredible opportunity to not only build connection with students, but they also see environments that sometimes educators don't get to see. And again, they have a different environment, a different platform where they can make relationships and create and strengthen those with students. The brain requires relationships. The brain requires conditions of safety and connection. And when we don't have those, as the brain and the stress response systems are developing, we struggle behaviorally. We struggle with how we feel and how we sense and how we experience our worlds. I want to add to the original ACE study. Wendy Ellis has done some research on the pairs of ACEs. And this is really important for us in transportation as parents and as educators to understand that not only are there individual adverse childhood experiences that affect our families and our students and all of us, we can see historical adversities. We see institutional adversities. There are community adversities, children and adolescents and families that are growing up with housing insecurity, food insecurity. And again, looking at the disproportionality and the racial disparities in the way we discipline children. So, adversities can be big traumas, or they can be an accumulation of an event after an event after an event, or where there's rupture after rupture after rupture in relationship or in those perceptions of safety.
And that really comes down to kind of the difference between trauma-informed and trauma-responsive. Is that correct?
Absolutely.
Okay.
Yeah. So trauma-informed, and I don't think there's a real firm boundary between those. They do blend. But my understanding, and from the research and from the application of the research that I've done, trauma-informed is where we are now aware of the implications and seeing how our physical and emotional and mental health outcomes are intimately tied to the adversity. So the higher an adversity the child has, so if a child walks into school with 4 or more adverse childhood experiences, coupled with community adversity, coupled with historical intergenerational trauma, then that child is 40 to 50 times more likely to have academic and behavioral challenges. So trauma-informed is the awareness of the research and really beginning to understand the correlations between the brain research and those physiological and mental and emotional health outcomes. Responsive is when a school, a district is taking action in a contextual way. And I want to clarify what I mean. I walk into schools all over the country and I work with districts everywhere. And they will say, Lori, we are a trauma responsive district. We are implementing this program, or we have developmental design set up, responsive classroom, conscious discipline, zones of regulation. I want to be clear in that a responsive, trauma responsive district is a district that is not only looking at adversities and trauma, but they are changing their discipline protocols. They are understanding that children carrying in trauma and adversity are carrying in pain. And when we discipline in traditional ways by threatening, nagging, yelling, suspending, pushing away, isolating, we're actually reactivating those stress response systems and re-traumatizing. And we don't mean to do that. And it's a concern because our special education population and our Black and Brown students, this is happening at an unprecedented rate. This is what my new book is about. And we're really looking at the application of educational neuroscience, this framework that has 4 pillars, and how it is a responsive framework, but it's not scripted. It's not to be implemented with specific practices and strategies in a program affiliated way, but it is a way to really rethink and reimagine and integrate discipline protocols that are paying attention to trauma and adversity and the effects on brain development.
Okay. And what's the name of that book again?
So the new book is coming out. It's going to be out 2021. It'll be pre-ordered in 2020. And it's called Connections Over Compliance, Rewiring Our Perceptions of Discipline.
Great. Well, we'll definitely be on the lookout for that. And want to remind our audience, too, that we are keeping our fingers and toes crossed that we will see you in person at our STN Expo Indianapolis in October. So please do your best to keep everybody safe and healthy so that we can continue to have that event. And before I let you go, though, I can't let you off the hook. I need to corner you on this one. Being a special education teacher, a lot of controversy right now on, do we send kids back to school in class? Do we do remote? Do we do some kind of hybrid? There's been a lot of medical opinions on this saying that students need to be in school. Where do you fall on that conversation?
So I fall in rigorous collaboration between parents, between administrators, between the leadership in schools, and paying attention to educator brain and body state and what is best for everybody. We have never in this world experienced anything like this. We don't have a precedent for this. So I really feel deeply for districts that are trying to figure out what is best for families, communities, and students at this time, because our kids need to be back in school. They want to be back in school. Our teachers want to be back in school. But we are in a state right now that I'm not sure is prepared for the implications and the ramifications of what COVID is still bringing on. So it's a really hard one. I really am on the side of collaborative discussion right now, and really taking a look at the statistics and the science is going to be very important. We've got wonderful data that is given to us every single day. So I think we have to pay attention to that.
A lot on all of our plates, certainly. Lori, thank you again so much for joining us. It was great to catch up with you.
It was great to be with you too, Ryan, and thank you for the opportunity. And hopefully I will see you in Indianapolis in October.
Definitely. We're looking forward to it.
Want to extend a special thank you to Tim and Lori for coming on the podcast today. We appreciate you guys both taking your time to share with us. Also want to remind everybody about the Bus Technology Summit virtual that School Transportation News is putting on September 22nd through the 24th. Check out bustechsummit.com for more information. Wanted you to all remember you can subscribe to this podcast on Apple Podcasts, Spotify, wherever you listen to podcasts. Visit our website at stnonline.com for all the latest news and perspectives on coronavirus and school startup. Thanks again to our episode sponsors, TransFinder and Zonar. Stay safe and well. We'll see you next time.